From that short break, you're watching NBS. This is a breakfast meeting, and I am Julius Buchana. Talking about the educational institution transition from private to public, it is one of the things that any joy would come of the institution like that. After having a graduation last week on Friday, which was tremendous on social media, it caught a lot of people coming in from southwestern Uganda saying Kabale is one of the regions that deserve to have a university that's strong. And this morning, Kabale University is strategically located in the Francophone, Anglophone, and Swahiliphone in the southwestern corner of Uganda in Kabale municipality. In 2015, Kabale was transformed from a private chartered university to a public university. And this made it the first to be in the university in Uganda to go through this kind of transformation. This morning, we'll be talking about managing institutional transition from private to public, the story of Kabale University. Joining me this morning is Professor Benon Basheka, the first Deputy Vice-Chancellor of Kabale University, and Professor Manipo as well from Kabale University, a Professor for Public Health in the same university. Welcome to the show.
Thank you.
I'm not a doctor, neither am I a professor, but I'm hosting two professors as well. I would like to know, briefly, how does Kabale transit from private to a public university? I'm going to start with Professor Basheka.
Yes, thank you, Julius, and the viewers. First of all, the university, the idea to start the university was started in 1995 when the eminent leaders of the region thought of that there was a need for university in the region. And then in 1999, they applied for a license from the Ministry of Education then. And then subsequently, within the same year, the district local government of Kabale, then as it was, allocated the university 53 acres of land at Chikunjiri campus, which has 50 acres, and then in Chikoni has 3 acres. And then in 2001 and 2002, the university officially started as a private community university. And it started with 42 students, and of course, few academic staff and a few students, as I mentioned. And then by 2014, it was able to attain a charter by the National Council for Higher Education, which is the highest recognition in the country. And in 2015, the idea to take over the university was mooted. Of course, the leaders in the region showed an interest that Kabale should be taken over. And at that time, there was a debate on whether it should be an affiliate college of Mbarara University or whether it should be an independent university. And I think it was eventually agreed that it should be an independent university. And that's how in July 16th, 2016, there was a statutory instrument which took over officially the university. And then there was a process of the government systems. For example, the Auditor General's office had to come in to audit and provide financial statements on what the government was taking over, because it had to take over the assets and the liabilities. And eventually, the processes, once that was concluded and there was a statutory instrument passed by the Act of Parliament, eventually the university was taken over and the University Council was constituted. And once the University Council was constituted, then its committees were also established, and the process of taking over the staff from the private dispensation to the public dispensation had to start through a process of validation which was guided by the Ministry of Public Service. Those who met the criteria were, there were readjustments. For example, someone who didn't have a PhD couldn't be a lecturer and had to be assistant lecturers, and the process has been like that.
All right, before I cross over to Professor Edward Manipo, let me just ask, what is the staffing capacity of Kabale University?
We are currently about 360 academic and administrative staff, but that is again still below the expected, that is about 20% of the staff established structure. And we are able to fulfill our mandate by having part-timers and then visiting lecturers. And out of those 360, About 90 are PhD holders with 18 professors and associate professors, about 24 senior lecturers, and then I think about 50 lecturers, and then the rest, the majority are assistant lecturers and teaching assistants. And in our balance, they are more teaching assistants and assistant lecturers at the lowest level, but we are trying to reverse that trend. Once we get a chance to recruit, we are trying to recruit only PhD holders to build the capacity of the university.
So where are you leaving the doctors? I mean, the people who have masters, if you're to recruit that. But that question will be answered a bit later on. Professor Edward Manipo.
Yes, please.
There is quite a fear of COVID-19 pandemic that has left most of the institutions, higher institutions of learning, injured, both economically, psychologically for the students. How is Kabale University handling?
Well, thank you very much for the question. Kabale University, by some kind of foresight, had actually started preparing for the effects of COVID-19 even before the epidemic reached Uganda. We had already started a study group, and we were already learning much more about the disease before it was announced in Uganda. And there was a committee which was set up in the School of Medicine, and we went through the biology, so to say, of the disease, of the organism, and then we looked at how it was affecting people, what services would be needed, and for an institution like Kabale University, how it would be affected and what we need to put in place. At the time, we put in place a collaboration mechanism with the district local government and the regional referral hospital in Kabale, so that we could be able to collaborate in the case of any eventuality. And indeed, by the time the government caused a lockdown, we were already some steps ahead. And we were also able to establish a task force on COVID-19 within the university. Members of staff, myself inclusive, were members of the district task force and the hospital task force. So we had gathered a lot of experience from working with the hospital and the district, and eventually we transferred this experience into the university. We set up SOPs appropriately, hand-washing facilities, guidelines on wearing masks, temperature check positions, and social distancing. We had to spread out our activities. We reduced the number of staff who were coming to work, and we were able to keep all the staff safe, because there were no students, but there was a skeleton administrative staff at that time. We were able to keep them safe until eventually the lockdown was eased, and we were able to bring more staff and more students on campus. And that was as far as the prevention mechanisms were concerned. But at the same time, we also had to go through a major transformation. It's a university which was predominantly face-to-face, was conducting face-to-face teaching. We had to transition to blended learning, to teach people how to do online learning. Previously, many people didn't know or didn't trust online learning. So we had to first overcome these fears, take them through the processes. Many people, yes, they knew how to write on the boards and do what, but they didn't know how to make online presentations. So they had to go through this process. We trained them. Our IT team worked over and above their normal limits. They trained staff. Later, when we were permitted to bring students on board, they had to train all the students to make sure that what the students have and the teachers have is compatible. So now, currently, I would say about 60% of our teaching is online and 40% is face-to-face. So with this, we've been able to cope. In some areas, especially like the clinical disciplines, I'm from the School of Medicine, we have had to make arrangements to train some of our students in neighboring hospitals, because if you have a ward, let's say, which takes 20, 30 patients, and you have a class of 15 students, you cannot put all of them on the ward and ensure adequate social distance. So we've had to make MOUs with some hospitals. Others, discussions are still ongoing. We have got contact with 7 hospitals within the southwestern region, all the way from Kasese, Kaganda Hospital, Kisoro Hospital, Mutolere, Chisizi, Rugarama Hospital, and a number of others, to help to take on some of our students because they have the adequate capacity, Nyachibale Hospital, etc. So in so doing, we have spread out the students. So we've reduced the risk of the students getting infected or spreading the infection if they have it to the patients and the lecturers. So there's been a lot of activity in the area of COVID prevention and control. And we are happy that I think since we started, after the COVID came, only 4 medical students have been confirmed positive. And these came with the COVID from home after the lockdown was eased. None of them has picked COVID from the university. So that is some bit of success in that line.
All right. One would say you've handled the COVID-19 pandemic as a university in an A-class form.
Yeah.
But again, as a professor for public health,
yes, please.
How would you advise government on managing and handling academic institutions during the pandemic?
Well, I should say the government has done a great job in guidance. First of all, they put in place standards to be attained before you can be permitted to do teaching once COVID set in. So Kabale University was among the first universities to be accredited by our regulators, the National Council for Higher Education. They were among the first universities to be accredited for online teaching and to be accredited as being safe, safe from COVID as far as public gatherings are concerned. So we had to go through 2 inspections, and the inspections by the National Council for Higher Education are no-nonsense activities. You must meet the standards. Those ladies and gentlemen are very serious with their work. So now, that is a good job by the government, putting in place standards. The next step is enforcing the standards and ensuring that the adherence to these standards is sustained. Okay? So what the government can do is to continue inspecting the facilities, especially, of course, for public universities. The government is duty-bound to also provide the infrastructure and the financial support, because some of these inputs to ensure safety do require some bit of money which comes from the government in the case of public institutions. In the case of private institutions, definitely they have to look from their usual sources. Some have investors, others use student tuition. So they all have to up their investment in order to be able to stay safe. Because, for example, a classroom, lecture room which is to take, let's say, 50 students, now can only take between 15 and 20. So where do you take the others? Either you must have more physical space, or you must teach the students in shifts, which means you have to pay the lecturers more to teach the same lecture several times over, or recruit more people. So it does require extra investment. And the government, of course, we do know that COVID affected not only the academic institutions, even the revenue sources of government were affected. But we do hope that the government will be able to raise the financing so that the facilities can be able to, and the human resource capacity can be able to be expanded so that they can be able to teach safely. Yeah, so that's largely what I would say. So inspection, standards, and then expansion of the facilities.
Awesome. Thank you so much, Professor Manipo. Now let me talk to Professor Basheka. You've kept quiet for quite some time. As a professor and the first Deputy Vice Chancellor of a university, what are the key programs academically that one would look out for in Kabale University?
Yeah, thank you, Julius. The programs one would look for in Kabale University are within the 9 faculties and institutes. Currently, we have the School of Medicine, so certainly there you would expect the Bachelor of Medicine, the Bachelor of Public Health, and we also have a Master's in Medicine, Gynecology, and Obstetrics. And then we have a Master's in Public Health. Then we also have a Faculty of Engineering, Fine Art and Design, where you would find the faculty, the courses to do with engineering. And we are, I think, one of the 4 public universities in this country that are offering engineering courses. And then when you go to the Faculty of Agriculture, you would find their master's programs in agriculture. And you know the region is dominantly agriculture-based, the bachelor's in agriculture. And then we are also trying to start a postgraduate diploma in post-harvest management within that same faculty. Then we also have the Faculty of Education, where they are currently, Senate has approved a PhD in education, and they have a Master's in Education, and a Bachelor of Science in Education, and a Bachelor of Arts in Education. And then we have a Faculty of Computing, Library and Information Science, where they have a Master's in Information Science, they have a Master's in IT, and a number of bachelor's programs. We have a Faculty of Economics and Management Sciences, where we have a PhD in Business Administration by coursework and research, and also a PhD in Business Administration by research only, and an MBA, a Master's in Human Resource, and other bachelor's programs. Then we have a Faculty of Arts and Social Sciences, which has, where I belong, I'm a professor of governance. It has a PhD in Public Administration and Management by coursework and research, and also a PhD in Public Administration by research alone, and a Master's in Public Administration. That faculty has a Master's in Institutional Governance and Leadership, as well as a Master's in Monitoring and Evaluation, and the bachelor's programs. Then we have a Bachelor of Science, which initially the Faculty of Agriculture was part of the Faculty of Science, but in December 2020, they were separated. And now the Faculty of Science is designing its own programs. I think the Senate has passed a Master's in Mathematics, and Geology, and this oil and gas, and the natural resources. Then we have the Institute of Languages, which specializes in Kiswahili and language education generally. And then those are the programs you would look at. Now we have bachelor's programs, postgraduate diplomas, the master's programs, and now the PhD programs, which completes the academic hierarchy. Yeah.
All right, briefly tell us, a person would like to know, what is the strategic direction of Kabale University in regards to the academic needs of this country?
Yeah, the strategic direction of the university is informed by, first of all, the global developments, because as a country, we are part of the Sustainable Development Goals. We are also part of the African continent and the African Agenda 2063 and the East African region, as well as when you come to Uganda, we have the National Development Plan, which is anchored on human resource development and bringing out a certain number of skills. And as a university, we have a 5-year strategic plan, which started in March of 2020. Immediately, Council approved it, then COVID came in. But our strategic plan in the next 5 years, we anticipate to focus on 6 areas. One is strengthening the governance and management systems across the board, because you can only build a university once there are strong governance and management systems. Then we also want to attract, develop, and retain the competent and qualified academic and administrative staff within that period. Then we also want to expand our infrastructure facilities. We need buildings for students, buildings for the staff offices. Then we also want to focus on academic programs which are relevant to the national development of this country. like I have said, we are mainly science-based. The university was started with a bias in science education, and that's where we have the biggest niche. Medicine, faculty of engineering, faculty of agriculture, faculty of science, science education. And then in the next 5 years, we also want to scale our research, publications and innovations credentials, because as a university, we don't want to be a glorified secondary school. So we must be able to engage in cutting-edge research. We must be able to engage in innovation, and then we must also be able to increase the research publication. And then in the next 5 years, we must be able to diversify our resource base. From relying on student fees, we must be able to write grants. We must be able to engage in income-generating activities that can support the financial resources we receive from government. And those are the 6 core areas around which the strategy of the university in the next 5 years is anchored. And of course, we have a master plan, 20 up to 63, which was approved by the University Council. We shall be focusing on implementing that master infrastructure plan of the university.
All right, thank you so much, Professor Bashika. Turning to public health, Professor.
Yes,
let's talk public health.
Okay.
What student and staff innovations do we see from Kabale University in regard to the COVID-19 pandemic?
Okay, well, I can maybe start from, I can say the approaches have been mainly in 2 broad categories.
Yes.
First category is from the staff, then from the students. From the staff side, we've had administrative innovations, and then I would say academic contributions. The administrative innovations have been, first, the management decided to stagger the admissions of students, the reopening of the university. So we first started with the finalists, in line with the national guidance from the Ministry of Education. Finalists came. There were a few, we could handle them safely, spread them around. Then later, we brought the new students on board. Then progressively, the continuing students have come on board. They are just reporting. So that alone has been able to keep the students and the staff safe because of the small numbers that we kept on campus. Plus, of course, even management of events, like we canceled sports activities, graduation recently. We had a scientific graduation, very few representatives. Then, technically also, our staff were deeply involved in responding to the outbreak. I said that 60% of our teaching is online. The online platform that we use was innovated by our own staff. It was homegrown. Robert Tumusime in ICT, Jones and Murangira and their group, they did a great job. So when they brought this up, by the time the National Council for Higher Education was coming to inspect for readiness, for us we had our own homegrown platform running. On the student side, our students were also deeply involved. They innovated, the students from the Faculty of Engineering innovated equipment for hand washing, non-touch hand washing, solar powered. And we are the first people to innovate this thing, but of course, as given, I think, our location and the level of awareness about patents, we did not rush to patent it, and some other people innovated a similar thing and patented it before ours. But I still think that ours is superior. So they did that. And at the same time, some students went into the activity of developing health education messages. Quite a number of students have created songs, and we are now in the process of recording, and this time we shall patent those particular songs, which have very potent COVID education messages for the general public. So broadly speaking, these have been our areas of innovation.
All right. I may ask another question.
Yes,
what are the science-oriented disciplines in Kabale University, and how are they synced to make sure that the national agenda for supporting science education is uplifted?
All right. As the DVC has said, the university is, broadly speaking, a science-oriented university. Out of the 9 faculties, we have 6 focused heavily on sciences. Some are totally science-based. For example, let me start with the education, the Faculty of Education. We do train science teachers at secondary level and at primary level, okay? Different levels, diplomas and bachelor's degrees. And teachers, of course, have got a multiplier effect. So they will contribute to the national agenda on science education. So, and there are quite very many students. Then we go to other faculties. We have a Faculty of Medicine, which is purely science. We produce doctors, bachelor's degree, master's degree in obs-gyn and in child health, pediatrics and child health, as he mentioned. Then we have a master's degree in public health. We have programs in health promotion and education, which are coming on board. We already have programs in health, environmental health, and in health services management. Then we have the Faculty of Science, which, as mentioned, has already got mathematics approved. And you know, STEM is one of the key issues in the National Development Plan. So mathematics is given. Actually, the dean of the Faculty of Science is a pure mathematician. He does nothing else other than numbers. And so that is an area which is very strong. And we have, by the way, I didn't mention that we also have courses in anesthesia. The country lacks anesthetists. And we have a whole program of Bachelor of Anesthesia and Critical Care Medicine, and a diploma in anesthesia. Then we have the Faculty of Engineering, we're at different levels, certificate, diploma, and bachelor's degree. And then we have got the Faculty of Computing and Library and Information Sciences. And people are busy developing apps, developing enterprise management systems. So the place is quite active. And then the new Faculty of Agriculture and Environmental Sciences, which, as the professor said, is busy developing programs in land use, in agricultural post-harvest management, in animal animal husbandry, and then crop research. So the place is a beehive, I should say. Within 2-3 years will be our contribution to the national effort in development of science will definitely be felt. Yeah.
All right, thank you so much, Professor. Professor Bashaka, what are the key benefits of government taking over Kabale University?
I would answer that from, I think, 5 broad categories. Because there are benefits to the individuals. One, the individuals have been able to get jobs, and you know, once you are employed in a government university, you are secure. You are at least secure in terms of payment of salary. Government
public service.
Yes, never fails to pay. Then 2, again on the individuals, there are students who have been able to attain education because of that government takeover. And our rates are relatively still low. And then again, to the individuals, there are those who have acquired opportunities within the university in terms of what the university offers. The second benefit could be going to the groups. For example, the university is a public university, and therefore it procures goods and services as well as the works. So you find a group companies which are getting business from the university. They are those who are supplying stationery, those who are supplying all the services which are needed within the university, the contractors. If we are doing construction, the suppliers also benefit. Then the other benefit would be to government itself, because we have been able to contribute to the building of capacity, and we contribute to the resource pool of the country. In the last graduation, we were able, for example, to produce the first engineers in the university. Next year, we shall be able to put in the market the first medical students. After 3 years, we shall be able to produce the PhD holders. And then, of course, we also offer advisory services. The individual staff offer advisory services to government at different levels. And also to government, Kabale University has offered a case study because we are the first university to be taken over. And therefore, I'm sure if government is engaged in any takeover, like is the case in Mountains of the Moon, as well as Busoga University, Kabale University becomes a reference point as far as the case study is concerned. Then there are benefits broadly to society. And that's where the bigger role of the university comes in, because economically as well as socially, the takeover of the university by government has benefited. Currently, we have a budget of about 40 billion shillings as a university, and that money, the biggest percentage is going to salaries. Once you pay salaries, that money has to be spent within the region because the academic staff, the administrative staff, as well as the students must get food, they must get accommodation. So those are benefits which are going to the university. And I think if you check the value of land within Kabale has extremely increased, partly because of the benefits brought by the government takeover. And there are hostel owners who are benefiting economically. There are also the financial institutions which are benefiting because they also get, the staff get loans from these financial institutions. At a broader level, there are benefits, for example, brought by specific faculties. Like the Faculty of Agriculture is now able to provide advisory services to the region as far as agricultural development is concerned. The Faculty of Medicine, the School of Medicine, we work with the Kabale Regional Referral Hospital, where all the senior staff of the School of Medicine are part of the staff of the regional hospital. They are in the hospital, they are attending to the patients, and therefore the region, the hospital has now a bigger resource pool. The Faculty of Engineering, the staff who are there are also offering services to the broader community, as well as the education, the Faculty of Education, which is the biggest in terms of the university strength. It has the biggest number of students, with the biggest course being the Bachelor of Science in Education. And all those, now the region is able to get, the employers are able to get resources directly from the university. So there are immense benefits which have been brought economically, socially, to the individuals, the groups, to the government, as well as the broader society.
All right, the transformation of Kabale University from private to public cannot end just in a little bit, but I'm going to request Professor Edward Manipo to give us the closing remarks about the topic for today.
All right, thank you very much. I would like to echo the messages of His Excellency the President, that COVID is still around. Actually, it is coming back in a new way. And it is, as we have noticed in the most recent couple of days or weeks, the number of cases is increasing. It is more deadly. It's killing people, younger people than it was in the beginning. So my real message now is, let us be safe. Let's observe the SOPs as advised by the Ministry of Health and often repeated by His Excellency the President, so that we all stay safe to be able to see the bright future that we are all looking towards. So I think for me that is all that I would say, and maybe in terms of government, as we have said, that the COVID has exerted certain pressures that institutions must respond to, and if we are a government institution, we rely a lot on our parent institution, which is government. Yes, we look forward to government increasing maybe from the 40 billion that Professor Washeka has mentioned to something more significant in order for us to be able to respond meaningfully to the COVID attack.
Well done. Need I say more from the words of Professor Edward Manipo? Professor Bashika, your last remarks.
Yes, first of all, I appreciate NBS, the management, and the owners. And I also must state this is my first appearance on a national television. The university is there for the public. Some people may have a feeling that Kabale is located far, but we know what we are doing as far as education is concerned. So let the parents bring the children at all levels. Those who want to do a PhD, Julius, you also said you are not a PhD holder. I encourage you, you can apply and join the PhD program. And we shall be able to attend to all classes of people. And we are a Francophone university. We connect the Rwanda, we connect Congo, we connect Tanzania, we connect Burundi. And therefore, we are strategically located, and the programs menu which we have outlined are able to benefit the public. That's
all right. The talk of Kabale University is one that wouldn't even get done with it in about an hour or so. But again, as we conclude this, COVID-19 is coming. The president is talking to the nation on Sunday. And if you have not been at the ICU of Mulago Hospital, you wouldn't want to be there. Wash your hands, social distance, make sure that you keep your mask on. Even your nearest neighbor would be one to get you to this virus. So I would urge all the nationals of Uganda, if you want the bus to get opened, if you want the social distancing in taxis to be abolished from 7 to 14 as usual, go have that jab of the vaccination and make sure that you get the date for the second jab so that the country can receive a large number of vaccinated people for us to be safe. It is very hard to lose a very good relative, a family member, a person close to you to COVID-19. Yet the messages have been all over social media, television, radio. The effort has been there. It is now up to us to fight this virus with tooth and nail. Have yourselves a good morning.